Hello and welcome to New Mexico Rising. My name is Abby Max. On this week's show, we have this.
You know, New Year's resolutions aren't just about starting these big new habits. It's really about checking in with yourself and choosing what fits into your everyday life. I always say focusing on small, realistic changes makes it so much easier to stay consistent and build momentum.
We just had the pet pitch competition the other day, and we learned all about some new products coming to market, ways that we're going to make veterinary medicine more efficient. Your veterinarian can spend a lot more time talking to you, connecting, and bringing better health care to your pet.
The dynamics in our line of work never changes. It just changes the fact how severe they are. You know, higher prices is absolutely bad for us.
You know, hey, rather than giving up on your resolutions, maybe take a little bit of a pause and dig deeper to understand what values shape your attitude.
All that and more right here on New Mexico Rising. A serious illness doesn't always start with the obvious warning signs. For one man, a broken leg led to a diagnosis of multiple myeloma, a rare blood cancer. Joining us are Dave, who has been living with multiple myeloma, and Dr. Robert Rifkin, a hematologist-oncologist with UC Health System. Thank you both for being here.
Thank you for having us. We're delighted to be here on behalf of GSK.
Dave, when you first heard the diagnosis, what was the hardest part to take in?
Well, when I was first diagnosed, I should say it all began with a routine and simple visit to my primary care provider, and blood was taken, and the next day they called me and told me I was very anemic, and I was referred to an oncologist at a Boston area cancer facility, which is close to where I live, and they drew blood. And they then told me to wait for the results, and while I was waiting, I was leaving work the next night, stopped in the men's room, and I slipped and fell, and I broke my femur and did damage to my hip. And now I'm lying in a hospital bed waiting for surgery. And while I was lying there, that's when I was told I had multiple myeloma. And I had no idea what multiple myeloma was. I'd never heard of it, so I didn't even know if it was serious or not. Well, I had the surgery, and I was then released 2 days later. I went back to see the oncologist, and he explained to me just what multiple myeloma was and that I had a very aggressive form of the disease. And I began my treatment that same afternoon, and this all unfolded over only about a 5 or 6 day period.
You experienced more than one relapse. How has that changed the way that you look at everyday life?
Yeah, that's true. I've been fortunate over the years to be in remission several times, but I've also experienced several relapses. And when that happens, I would say my feeling is one of being discouraged, disappointed, and certainly scared. Because when you go through a relapse, it means the treatment plan that I'm on is no longer working. And we have to find something as a replacement very quickly. And if I look back over the now 7 years of this journey we've been on, my wife and I, early on we thought we'd never be able to do anything, all the things that we love to do in our lives, and that hasn't been the case. As an example, we like to travel, and we've been able to travel out of state to go to my middle son's wedding. Last year in the fall, we went on a cooking and eating tour to parts of Italy. And the end of last year, our 3 adult boys and ourselves and our daughter-in-law went to an island for a week. And we're also dog lovers. We adopted a dog a couple of years ago. So, yes, it's a challenge to navigate this disease. It's been 7 years, but we've continued to do the things that we love to do. And our lives have maintained a very high level of normalcy.
Dr. Rifkin, what should people understand about multiple myeloma and how it's treated?
So people should understand that it is a blood cancer with about 36,000 new cases in the United States this year. Importantly, there are over 150,000 people living with the disease and getting treated. It's an exciting time because we have many new treatments. And in particular, Blenrep is a new drug that given in combination with bortezomib and dexamethasone was approved by the FDA to treat patients just like Dave, whose multiple myeloma has come back or didn't respond to 2 or more treatments. Importantly, in this day and age, it's important to talk to your team and discuss all of your medications with your team and any potential coexistent medical conditions. In addition, Blenrep can cause serious side effects, including eye problems, which can result in decreased vision. They're quite common and can be severe, but importantly, those taking Blenrep need to see an eye care professional prior to each dose. This will ensure safety and efficacy of the drug, which produces deep and durable remissions.
How are newer treatment options giving patients more choice today?
Well, I think in this day and age, you can tailor make your therapy. The Blenrep that we just reviewed can now be given in a community setting, and that's very nice because patients don't have to travel far to get state-of-the-art therapy. In addition, if you look at the Multiple Myeloma Research Foundation and International Myeloma Foundation, they have excellent patient-facing education sites and update new treatments regularly.
And for viewers who want to learn more or talk with their doctor, where should they start?
I think where you should really start is with your oncology care team and then the 2 sites that we just mentioned. But it's important, the more everybody becomes educated, the more they are empowered to pick a treatment that can be tailor-made to their myeloma.
Dave, thank you for sharing your story. And Dr. Rifkin, thanks for the education.
No, thank you.
Thank you for having us.
Pets are cherished members of many families, but it can be easy to put off visits until something feels urgent. New research shows many pet parents wait until a pet is sick or in pain, and many turn to social media for advice. Joining us live from VMX 2026 in Orlando are Jean O'Neill with NABC and Dr. Dana Varble, a veterinarian and chief veterinary officer at NABC. Welcome to you both.
Hi.
Thank you for having us.
What is NABC and what is VMX?
Sure. So NABC stands for the North American Veterinary Community, and our largest product in the portfolio is VMX. And we're sitting here at the Orange County Convention Center in Orlando, welcoming 30,000 of veterinary professionals from around the world so they can take advantage of the over 1,300 hours of continuing education sessions, as well as visit with over 750 of our exhibitors to find out what has changed in veterinary medicine over the year. And as fast as human medicine is changing, that's as fast as veterinary medicine is changing. So it's important for them to stay ahead of that, to maintain that cutting edge discipline that they have when they get back to their hospitals and clinics.
And why is this event important for veterinarians?
So this is the 43rd year that we've had this event put on. I can tell you that the attention and the attendance has grown exponentially over the years because this is where all of the new products, all the new services and methodologies, diagnostic services are being displayed because it sets the year for the rest of the industry. It sets the year for them to continue on with bringing their products to market, getting them into the hospitals and clinics, and getting them into the veterinary healthcare team's hands so that they can provide the best options for your pets to maintain their healthier, happier lives.
And what makes VMX 2026 stand out this year? What are you hearing most about?
Well, we're always so excited because there's always so many new innovations that we see at VMX 2026. For example, we just had the pet pitch competition the other day, and we learned all about some new products coming to market, ways that we're going to make veterinary medicine more efficient. Your veterinarian can spend a lot more time talking to you, connecting, and bringing better health care to your pet.
And what is health span, and what does that mean for pets and people who love them?
Well, we know pets are living longer, but that's not enough anymore. We want them to be healthier throughout their lives. So we're seeing growing areas of veterinary medicine that are really giving a lot of attention to this. So, for example, canine sports medicine addresses a pet's need to move, addresses their joint health, pain management, even muscle and strength conditioning to make sure that even when they're 10, 11, 12, they're still going for long walks, playing fetch, and even jogging with you.
And why is it so important for families to have a trusted veterinary team, especially when so many people look online for advice?
Yes, well, Here at VMX, we're lucky that we don't just take care of the veterinarian, but we also help educate everyone on the veterinary healthcare team, from the front desk where the client service representatives to meet you, to the veterinary technicians that provide super important nursing care for your pet while they're in the hospital. We make sure every member of the team has the newest information, the latest technology, and all this information that they can share with you. So they're your experts, not just social media and not Dr. Google.
And the research shows many families delay regular vet visits. Why does early preventative care matter so much?
Well, we know that if you keep up with your annual wellness exams, there's so many interesting ideas, new tests, new products that are coming to the market today that we can take care of in those annual wellness exams that can prevent diseases from getting worse. We have more options than ever to slow them down and, again, make sure that we can maintain that health span through the life of your pet.
And where can viewers go for more information?
Sure, your viewers can visit us at nabc.com to see all the education that we provide to everybody in the veterinary healthcare team. But more importantly, advise them to ask their veterinarians what are they doing to maintain their credentials, to keep that cutting edge philosophy that they want to exhibit in their hospitals and clinics. Where do they go for that education? And I wouldn't be surprised to hear them say they go to NAC.
Jean, Dr. Varble, thank you both for being here.
Sure, thanks for having us.
A new year can feel like a fresh start, but big changes can also be hard to keep up with. Many people want simple ways to feel better without doing too much at once. Joining us is TV host and lifestyle expert Jamie Hess with easy wellness habits for everyday life. Welcome, Jamie.
Thanks for having me.
What is one simple tip to help people stay consistent with wellness goals?
You know, New Year's resolutions aren't just about starting these big new habits. It's really about checking in with yourself and choosing what fits into your everyday life. I always say focusing on small, realistic changes makes it so much easier to stay consistent and build momentum. And I'm happy to share that this is where Target can be a partner on your wellness journey. You know, the retailer is entering a new era in wellness, expanding its assortment by 30% with thousands of new items under $10. So Target's really simplifying what's defining wellness in 2026 with a curation of the newest trend-forward and budget-friendly options that just makes it easier to find what works for you.
And when life feels busy, what are some easy ways to take care of yourself?
Well, a big wellness trend right now is just kind of getting back to basics and being more intentional about those everyday choices, things like gut health, functional hydration, convenient protein. For me, it all starts in the morning with those simple swaps that help set the tone for the day. So my new favorite gut healthy breakfast is the Coconut Cult Probiotic Coconut Yogurt with flavors and single serving sizes you can only find at Target. I also like switching out my morning coffee with something called Rise Mushroom Coffee. It feels more balanced than my usual cup, which I really appreciate on those busy mornings. And then later in the day, when I'm craving something sweet, I reach for a Misfits plant-based protein bar. It is so tasty. It tastes like a candy bar, but it's also packed with protein.
And how can people build routine they actually stick with?
Yeah, I mean, self-care shouldn't feel like a chore, right? And it really works best when it's simple and realistic. I gravitate towards routines that don't take a ton of time, but still feel intentional. And Target is a great place to discover those self-care essentials. My new favorite is the Target exclusive Remedy Skin 3-Step Skincare Kit. So this is formulated by dermatologist Dr. Shaw. It includes a cleanser, a vitamin C brightening serum, and a moisturizing cream. It just takes all the guesswork out of skincare. Then for a quick moment of self-care during the day, I also love the Prequel Multi-Quench Hydration Face Mist. This fits seamlessly into my routine. And when we're talking about routines, I have 2 little boys, so those routines are everything. Having those everyday staples around the house really matters, and Target expanded its assortment with solutions for the whole family in mind, like the Tubby Todd All-Over Ointment, which is one of those great do-it-all staples. It's a rich, creamy balm made with plant-based ingredients. And then, of course, for my kids, they love something called the First Day Kids Multi-Gummies. It fits easily into those busy family routines. They're delicious gummies that are made to fill those common nutrient gaps and supports energy, focus, and immune health.
And what are a few simple ways to stay active during the day?
You know what? When I lose motivation, I have a simple life hack. Get a cute new workout outfit. That makes me want to get out the door, go to the gym, take that walk. And lucky for us, Target just launched a bright, colorful mix and match collection from JoyLab, like this piped sports bra paired with the matching high-rise piped leggings. It's great for workouts, errands, and everything in between. And Target's actually going to be adding more than 1,000 new apparel and accessories items throughout the year, so you can refresh your gear with the seasons.
And where can viewers go for more information?
You can find everything we talked about today at Target stores, on Target.com, or in the Target app. It's just a great place to explore affordable everyday wellness options that fit into your real life.
Jamie, great tips. Thanks for sharing with us.
Thanks for having me.
After the holidays, many families are left trying to recover financially. New data shows credit card debt is at a record high. Meanwhile, people are giving up on their money goals earlier in the year. Joining us is Dr. Erica Rasher, Chief Financial Wellness Advisor with Beyond Finance, here to share helpful guidance for a fresh start. Welcome.
Thank you so much for having me.
What does record high credit card debt mean for families right now?
Record debt can mean record stress for many families. We're dealing with an astronomical number of credit card debt. We're looking at a $1.23 trillion figure, which is just so much. And it just tells us that families are relying on credit cards just to get by. It's not for luxuries, but it is for our everyday essentials and expenses. And so when those balances keep growing, it creates this constant sense of pressure and uncertainty. And so for the average household, this isn't just a money issue any longer. This becomes a mental health issue because that persistent debt can erode confidence. It, of course, increases stress. It really ratchets up the anxiety that is felt in a home. And it just plain makes it harder to plan for the future confidently and securely.
And why do so many financial resolutions fail by early spring?
So right now, January still might feel like a reset. But according to the survey we just did, 83% of Americans don't persist with their financial resolutions past March, which tells us that Americans have really stopped believing that those resolutions lead to lasting financial change. But it's not because people are failing at resolutions because they're bad at sticking to them, but it's rather because goals don't tend to stick around if they aren't aligned with a person's values from the get-go. So a lot of people rely on the motivation, the excitement of the new year, that willpower piece. And if you're listening to this right now, you might be saying, I am low on the willpower fuel here. I don't have a lot of motivation left. And, my urge is, hey, rather than giving up on your resolutions, maybe take a little bit of a pause and dig deeper to understand what values shape your attitude, behaviors, and beliefs towards money, and work to address how they can improve your money management and financial wellness well past, the point of running out of willpower and well past March.
And what is one simple step families can take to start improving their financial health?
I think one of the greatest things a family can do is just bring some awareness and remind themselves that, progress made doesn't have to be perfect. We don't have to do it in step, by a certain time or by a certain date. It just has to be personal and sustainable.
And you mentioned about values. You encourage a values first approach to money. What does that mean?
Yeah, so I just mentioned, it being personal and sustainable. Sustainable financial change really does start with self-understanding and not self-criticism. The more you beat yourself up about financial decisions, the coulda, woulda, shouldas, the worse the outcome is going to be for you. You're not going to go as far as if you take this values-based approach where you really focus and start to identify what truly matters to you. So security, family, freedom, having a little bit of fun, stability even, to help guide you with your financial decisions. It takes us from this place of asking, why can't I stick to a budget, to this place of, what's driving my financial choices? Am I making these spending decisions in alignment with my value of stability, for example? Or is this financial choice going to take me further away from it? And once you're able to put it in that context, you can start to build habits that feel more supportive and nourishing and sustainable rather than them feeling restrictive or punishing.
Makes sense. Where can viewers go to learn more information?
Yeah, your viewers can go visit beyondfinance.com's financial wellness section. We've got some really great free tools and educational resources. But more importantly, we also have a free money mindset checklist that is designed specifically to help people reflect on their values and maybe, just maybe, reduce some stress along the way.
Dr. Rasher, thank you so much for joining us today.
Thank you.
Have you ever dealt with a UTI and felt like it just keeps coming back? Urinary tract infections affect millions of women every year, and for many, they're not just a one-time issue. Joining us is board-certified OBGYN and medical advisor at UCORA, Dr. Alyssa Dweck, to help us understand why UTIs happen and what women can do to prevent them. Welcome, Dr. Dweck.
Thanks for having me.
UTIs seem to affect women far more than men. Why is that?
They sure do. In fact, we see 11 million cases of urinary tract infection each year in the U.S. alone, and women are at much higher risk for UTI for a couple of reasons. First, their urethra is much shorter than a man's urethra, and this allows quicker and easier transit of bacteria to the bladder. Also, the hormonal changes that occur during a woman's reproductive life can increase the risk of urinary tract infection.
For women who deal with repeat UTIs, what does prevention really look like beyond just treating infections when they pop up?
Yes, well, 60% of women will experience a urinary tract infection in their lifetime, and many do have a recurrent infection. I recommend to my patients wiping from front to back when using the toilet, hydrating well on a daily basis with water to flush the urinary tract. Also, I recommend urinating after sexual activity, which flushes bacteria from the urethra mechanically and can be helpful to reduce infection. And I often ask my patients to consider a supplement like UCORA Flush Advance Plus in an effort to get a clinical dosage of whole fruit cranberry, which has evidence to suggest it reduces the risk of infection by making the bladder wall super slippery to bacteria so they cannot adhere and lower the risk of infection. It also has D-mannose, which can work in a dual action fashion to flush the urinary tract itself.
If symptoms start, what are some smart first steps women can take at home, and when should they reach out to a doctor?
Oh, symptoms are all too well recognized in anyone who's ever had a urinary tract infection. The burning, the urgency, the frequency of urination. I recommend, again, immediately hydrating with lots of water. I recommend over-the-counter analgesia for any pain if needed, and absolutely get started with a whole fruit cranberry clinical dose supplement such as the UCORA supplement I've mentioned. Definitely check in with your doctor, whether it's your primary care doctor or your gynecologist, for fever, chills, back pain, blood in the urine, just to be sure that it's not progressing.
And we hear a lot about cranberry, like you mentioned, for urinary health. What does the science actually show, and how should women think about using it?
Yeah, there's quite a bit of research surrounding cranberry. Cranberry contains or has PACs, an ingredient in it that coats the bladder and makes it more slippery to E. coli, a bacteria that most commonly causes urinary tract infection. So this is recommended as a preventative step by the AUA, the American Urological Association, to prevent recurrent UTI.
And where can women go to find more reliable information and support when it comes to urinary tract health?
Yes, please visit us at ucora.com. Not only is there information, of course, about our product offerings, but there's lots of general health information about the urinary tract and community to join as well.
Dr. Dweck, thank you so much for coming on the show today.
Thank you for having me.
Ever wonder how moonshiners keep a century-old tradition alive when the stakes keep getting higher and higher? A new season of Moonshiners is already underway, and it's pushing the limits like never before, from rising liquor prices to bigger risks and tougher crackdowns. So joining us today are Mark Ramsey and Digger Maines, longtime distillers and stars of Moonshiners on Discovery Channel. It's great to see you both. How are you two today?
Good to see you, boss.
It's great to be seen. It's better to be seen than viewed.
Yeah.
That's a good line. I love that. All right. I guess we're just hanging out today. We can't really be talking about anything that you guys do. So it's how are things? No.
Things are good.
We're not afraid to talk about what we've done. Sometimes it might save somebody from making the same mistake.
Oh, gotcha. All right. So this season opens with more pressure than ever. There's higher costs, tighter enforcement, bigger risks. What did that change for you guys day to day?
Cautious on all levels, whether it be the materials you're buying or looking in that rearview mirror to see if the police is on your back end.
You know, the dynamics in our line of work never changes. It just changes the fact how severe they are. Higher prices is absolutely bad for us, but the tariffs may be a good thing for us for liquor being sent out of the country. It puts more demand on non-tax liquor. So, it's a double-edged sword, but we're going to live with it and deal with it the way we always have.
And moonshining has deep roots going back hundreds and maybe even thousands of years. When you look at what you're doing now, what still feels the same and what feels completely different?
The amount of money we're making feels different, and the pressure feels a whole lot worse.
The thing about it is this upcoming season, Digger and I have kindly, we're getting back to our roots, back to our basics a little more, slowing down a little bit, trying to draw less attention to ourselves. And, it was good. Digger and I hadn't done anything just one-on-one together in a long time, and I think it'll turn out real nice this season.
It will. I mean, no matter what the dynamics, if you don't approach what you're doing for a living as a business, then it's not going to be a business long. We look at the future. We see what projections on sugar are going to be the next year. We tend to watch that. See where you can get the biggest value, and you can pass that value on to your customers and still make your profit margin handsome.
And there's a real sense this season of deciding how far is too far. Were there moments that you honestly questioned whether it was worth continuing?
Oh, absolutely.
Just about every day, right?
About every day, yeah. It every day brings its own set of challenges, and I think that's one reason that Digger and I are both attracted to this business so much, and the fact that we just love the heritage of it. Our forefathers done it. When the immigrants, the Scotch Irish and the Black Dutch came to this country, not only did they bring their couches and their tables and their furniture, they brought their liquor stills, and maybe we owe all of this to them.
And viewers see the danger and the drama, but they also see the craftsmanship. What do you wish people would better understand about the skill behind what you do?
Well, it should be their way of doing life and whatever their vocation is. Whether you're digging taters or making liquor, do the best you possibly can at it. And if anybody around you needs a little help, be the first one to extend that hand. That's what's kept this craft alive.
We're blessed in the place where we live and the area we grew up in, and people grew up here helping each other, and we like to continue that. And that's the way it's going to stay as far as I'm concerned. But it is a business. We do have to make a living. And but all in all, it's a good life. It's been a wonderful ride.
Mark Digger, I want to thank you too for joining me today. You can always catch new episodes of Moonshiners now airing on Discovery Channel, and follow the season as it unfolds with even higher stakes and deeper tradition. Hey, I want to thank you too for joining me today.
Thank you, sir. Have a blessed day.
Thank you for tuning in and checking us out here on New Mexico Rising. If you're a fan of the show and want to know what's going on behind the scenes, follow us on social media. We're at New Mexico Rising on Facebook and Instagram. Also, you can subscribe to our YouTube channels at New Mexico Rising. Thank you again for joining us right here on New Mexico Rising.